Good afternoon. I'm Mandy Cohen. I'm the Secretary of the Department of Health and Human Services for North Carolina. And today we have two special guests. I am joined by Consul General Jorge Archila of Guatemala and Consul General Claudia Velasco-Osorio of Mexico. We're also joined by Lee Williamson and Monica McGee, who are our American Sign Language interpreters, and Jasmine Matevier is our Spanish translator. First, I'll start with a rundown of the numbers. As of this morning, there were 106,893 laboratory confirmed cases, 1,188 people are currently hospitalized, and sadly, there have now been 1,726 deaths. While we are on steadier ground than most southern states who continue to see viral spread accelerate, we have not yet turned a corner here. North Carolina is seeing the benefits of difficult but a necessary approach that we have taken, prioritizing scientific evidence and easing restrictions slowly and responsibly. I recognize that this has been a very challenging time. Yet, people across North Carolina are taking actions to protect each other, including following the requirements to wear face coverings over the nose and the mouth. Unfortunately, we continue to see increases in cases, and there has especially been a notable and concerning increase in COVID-19 cases among members of our state's Latinx Hispanic community. That's why today the Consuls General of Mexico and Guatemala are joining Governor Cooper and our department to make an urgent call to the Latinx Hispanic community to take preventive measures against this virus. COVID-19 is highly contagious, and unfortunately, it's disproportionately affecting, like I said, the Latinx and Hispanic individuals and communities in North Carolina. Many members of our Latinx Hispanic communities work in essential jobs that are the backbone of the state's economy. The nature of these jobs put people at higher risk for getting infected from COVID-19 at work and then potentially transmitting it back into their communities. In light of the trends I mentioned earlier, we need to turn up the volume on our core preventive messages. To do that successfully, we need influential leaders sharing the message. That's why I'm so pleased to be joined by Consul General Jorge Archila of Guatemala. So right now, I'm going to turn it over to him.
Thank you, Secretary Cohen. Good afternoon, ladies and gentlemen. I am happy to be here today at this press conference to join forces with the State of North Carolina, the Department of Health and Human Services, and the Consulate of Mexico in order to get this important message to all of our community. Quiero agradecer la labor de todos los hispanos y latinos en el estado, guatemaltecos, mexicanos y todos los residentes del estado en general por su constante esfuerzo diario en sacar adelante a la economía del estado y sacar adelante a sus familias durante esta pandemia. Nos unimos el día de hoy para traerles este mensaje de precaución durante esta crisis. La enfermedad COVID-19 ha estado pegando muy fuerte a nuestra comunidad y debemos de tomar todas las precauciones necesarias para evitar que nos afecte directamente a nosotros o a nuestras familias. Es importante usar mascarilla, distanciamiento social y lavarse bien las manos para prevenir cualquier tipo de contagio. También alertamos a todos que si tienen algún síntoma o han estado en contacto con alguien que haya dado positivo, que se puedan hacer la prueba de forma gratuita sin importar su estatus migratorio y así romper esa cadena de contagio que nos acosa. Thank you to Governor Cooper, Secretary Cohen, for all the resources available to all to fight this pandemic. This is an opportunity for all of us North Carolinians to unite in order to defeat this disease. Muchas gracias a todos y siempre cuentan con nuestro apoyo en cualquier situación. Si tienen alguna duda o necesitan información sobre dónde hacerse la prueba o si necesitan recursos como comida o ayuda económica, pueden llamar al Consulado de Guatemala en Raleigh. Muchas gracias. I want to thank the work of all the Hispanics and Latinos in the state, Guatemalans, Mexicans, and all North Carolinians for their constant daily effort to forward the state economy and their families. We join today to bring you this message of caution during this crisis. The COVID-19 disease has been strong in our community, and we must take all the necessary precautions to prevent it from directly affecting us or our families. It is important to wear a mask, social distance, and wash our hands well to prevent any contagion. We also alert to all those who have some symptoms or have been in contact with someone who has tested positive that you should get the test done. The test may be done free of charge, regardless of their immigratory status, in order to break this chain of contagion. Thank you all, and you always have our support in any situation. If you have any questions or need any information about where to get tested, or if you need resources such as food or economic help, you can always call the Consulate General of Guatemala in Raleigh. Thank you very much, and thank you for Consul General Velasco as well for this initiative. Thank you.
Well, great. Thank you, Jorge. And now I'd like to introduce the Consul General Claudia Velasco-Osorio of Mexico.
Good afternoon, Secretary Cohen. Difficult times like those we are expecting today always require collaboration and dialogue, while showing friendship and mutual understanding. This is under principles that the Consulate General of Mexico has decided to strongly join Governor Cooper's effort to face the health emergency and join Secretary Cohen's call to come together in the fight against this pandemic. It is a joint task, which of course includes the authorities and all the organizations in our society, but also involves our community, our families, and above all, each one of us. The action that we have carried out with great effort over the course of several months of many fronts against COVID-19 will be ineffective if we let our guard down, if we do not become fully aware of the role that personally corresponds to us. I am pleased that the North Carolina government is mindful of the characteristics of the work Mexicans to do in food production and construction. I'm pleased that the importance of their contribution to the state economy is recognized, but I must also point out that I fully share their interest for the benefit of all in urgently reducing the high rate of infection that has been registered among Hispanics. This is imperative to attend each one of the authorities' recommendations, making sure that in our homes, their instructions are followed fully and without excuse, and that we all assume our responsibility in this emergency. Let me acknowledge, even briefly, the commitment of the government of Guatemala in the presence and dispose of Consul General Archila to once again thank Governor Roy Cooper, Secretary Cohen, and the team for their willingness to contribute this community common initiative. In these difficult times, more than ever, solidarity, unity, and joint work are key pieces to continue building the future that we share. This virus not will defeat us. Thank you so much. Los tiempos difíciles como los que vivimos hoy en día exigen siempre de la colaboración y el diálogo al tiempo que ponen de manifiesto la amistad y el entendimiento mutuo. Es bajo estos principios que el Consulado General de México ha decidido sumarse firmemente a los esfuerzos del gobernador Cooper para hacer frente a la emergencia sanitaria y se une al llamado de la secretaria Cohen para unirnos en el combate contra esta pandemia. Se trata de una tarea de conjunto que incluye desde luego a las autoridades, a todas las organizaciones de la sociedad, pero que también involucra a nuestras comunidades, a nuestras familias y sobre todo a cada uno de nosotros. Las acciones que con mucho empeño hemos llevado a cabo a lo largo de ya varios meses en muchos frentes contra el COVID-19 será en vano si bajamos la guardia y si no tomamos plena conciencia del papel que en lo personal nos corresponde. Celebro que el gobierno de Carolina del Norte tenga presente las características del trabajo que realizan los mexicanos en la producción de alimentos y en la construcción. Me satisface que se reconozca la importancia de su contribución a la economía del Estado, pero también debo señalar que comparto plenamente su interés en beneficio de todos, en abatir con urgencia el alto índice de contagios que se ha registrado entre los hispanos. Es imperativo atender cada una de las recomendaciones de las autoridades, cuidar que en nuestros hogares se cumpla cabalmente y sin excusa alguna sus instrucciones y que asumamos todos nuestra responsabilidad ante esta situación de emergencia. Permítame reconocer así brevemente el compromiso del gobierno de Guatemala en la presencia y disposición del Cónsul General Archila, agradecer una vez más al gobernador Roy Cooper y a la secretaria Cohen y a su equipo la voluntad de contribuir con esta iniciativa común. En estos tiempos difíciles, más que nunca, la solidaridad, la unidad, el trabajo de conjunto son piezas claves para continuar con la construcción de ese futuro que compartimos. Este virus no nos va a derrotar. Recuerden siempre las 3 Ws. Muchas gracias.
Well, thank you both for being here. By joining us in this effort, the consuls general, together with the nations they represent, Guatemala and Mexico, are sending us an important message about the value of community. We are all in the fight against this virus together. From the DHHS side, that's why we've made it a priority to create bilingual COVID-19 resources and community engagement strategies. Our Spanish language version of the Check My Symptoms tool lets people enter their symptoms to determine if they should get tested for COVID-19. Our bilingual Find My Testing place on our website allows people to enter their county or their zip code and access information about testing locations nearby, some of which are free. And our ongoing work to expand that testing has included the surging of free testing sites in Latinx Hispanic communities that previously had limited or no access to testing. And we're prioritizing hiring Spanish-speaking staff members to join our COVID-19 community teams who perform contact tracing by reaching out to people who may have come into close contact with someone who tested positive for COVID-19 and connecting them with resources, information, and support. We need an all-hands-on-deck approach to get critical public health information out there to people so that they can take action to protect themselves and their family. If you are a community organization, consider sharing our campaign resources. They're on our website at covid19.ncdhhs.gov. Again, thanks to our guests for being here today and for their partnership. Remember to practice the 3 Ws. Wear a face covering over your nose and your mouth. Wait 6 feet apart and wash your hands often. That's the 3 Ws. Wear, wait, and wash. And with that, I will turn over to your questions.
Our first question today is from Daniel Villota with Telemundo Charlotte.
Yes, thank you very much for this opportunity. We have been witnessing several cases of immigrants trying to get medical assistance because they are COVID-19 positive and they are having symptoms and they have been in hospitals, and unfortunately they are turned away. They are not admitted in the hospitals because they do not have health insurance or for other reasons that we don't know yet. My question is for both Consul Velasco-Osorio, Consul Archila, how Mexico or Guatemala are helping their immigrants in that unfortunate event if they are not able to get medical care in a hospital in North Carolina. Are you providing any type of assistance? Thank you.
Thank you so much for your question. Yes, of course, we are very aware that many Mexicans don't have insurance, and they can call us. We have a partnership, a very important partnership here in North Carolina, to help them and to guide what is going on, where they can go. They can call to the Mexican consulate, and we can provide assistance for them. Yeah.
Thank you for the question, and that is a very big concern. We at the consulate have been developing partnerships with local organizations, local clinics, and gather all the information so that any Guatemalan that would request or need any information from whichever county they live, either the state of North Carolina or South Carolina, we will have someone where to refer them, as well as other organizations. We are being actively trying to reach out to all the Guatemalans that have been registered at the consulate through our health window to give them all these resources and help them prepare even before they get any symptoms or prevent even to get sick. So thank you.
Thanks, Daniel.
Our next question is from Brian Anderson with the Associated Press.
Hi, Dr. Cohen. Brian Anderson here with the AP. Thank you so much for taking the time. Just wanted to ask, with the exception of Alamance Speedway, has there been a single example of an enforcement action that your department has taken against businesses for not complying with face mask order, business closure requirements, or capacity and gathering limitations?
Brian, thanks for that question. So there are a number of ways in which we work with businesses and organizations across the state to make sure they understand the requirements that are part of the executive order. There are a number of steps that we take before we would want to use something like our abatement authority. We do try to reserve that for excessive or flagrant violations of restrictions that we think, and to use that in certain circumstances where we think there are imminent hazards for folks in the community. So often we are trying to work with folks who may not be complying with the rules, first by reaching out to them in coordination with our local health departments. Then we make sure to also involve some of our local law enforcement partners in this, because we know enforcement is at the local level. And then after we've moved through that process, I will say many folks acknowledge and do come into compliance with those. And if necessary, then we will move forward with using our abatement authority.
We have a follow-up from Brian Anderson, AP.
As part of these discussions, have you had any discussions with individual candidates? I'm thinking of Lieutenant Governor Dan Forest holding maskless events. Have you had any conversations with any candidates for public office? And if so, which ones, and what have those conversations been like?
I have personally not had any conversations with folks who are running for office. Thanks.
Our next question is from Marlon Cardenas with La Noticia.
Hi, thank you for your time. My question was for the Consul Generals. I wanted to know that if since the beginning of the pandemic, have you guys had any cases of preparation and disposition of remains?
Yes, hello. Yeah, we are working with several partnerships, and we have in our social media, we have the list that the people can go to find and to support not only food and other resources like advocacy, or in this time is very important the mental health also, and we have all the resources in our social media. And of course, we are working in, if you have some case, or do you know someone that needs help in this issue, you can contact our Department of Protection and we can support them. Thank you.
Thank you. As the Consul of Guatemala as well, we've been very active on our social media, sharing all the resources available by the state, by local organizations, and reaching out again to all the Guatemalans. If anybody has any need, we've been able to refer people to food banks, to clinics, to any other organizations that will help even with rent or any other needs that they have. If you know any Guatemalans, please have them call the Consulate of Guatemala. Thank you.
Our next question is from Rose Hoban with North Carolina Health News.
Hi, Secretary. Thank you very much for taking my question. And I'm sorry the dog is barking. Sorry about that. It's the joys of working from home. Okay, so have you folks had conversations with officials in Texas and Arizona where there are other large populations of Latinos? What are they doing to reach their Latino populations, and what are they doing that might be different or the same from what's happening here?
Sure, I'll start and I'll see if my other colleagues want to jump in from the Consul Generals as well. So we are definitely trying to share best practices across states in a number of ways. I think some of the work that you're seeing us do, we saw modeled in other states. As you know, that we have supported 5 different Latinx Hispanic organizations that have deep roots at North Carolina, working close with the community. So definitely a best practice of engaging long-standing organizations in this effort. Also making sure that we have materials in Spanish and in English, as well as all of our online tools in both languages. So we talked about that. And then as we thought about our testing strategy as well, this is, I know in San Antonio in particular that they are doing this kind of testing work where they are surging testing sites that are free, that are paid for by the state in a number of their communities, and really trying to be mobile and bring testing to where people are. So we definitely have learned some best practices from others. But why don't I see if my colleagues want to share anything else that they may have learned? Anything from other states?
Well, thank you so much. That we have a broad consular here. We are 50 consulates in Mexico at the U.S., and all the consulates are working very close with the authorities and with the organizations. And of course, no matter their status, we are always ready to help everyone. And of course, that Secretary Cohen says, we are sharing the best practice in all our net of consulates. Thank you.
Thank you. Likewise, the Consulate of Guatemala. We have 21 consulates throughout the state. We've been trying to reach out to all the Guatemalans with important information on prevention. We've translated all the documentation and information, not only to Spanish, but to the different Mayan languages that Guatemalans speak throughout the state, to trying to reach them in their own native language. Thank you.
Great. Thanks, Rose.
We have a follow-up question from Rose Hoban.
Thank you. And this is a different question, and it's related to the question that the AP was asking. What are the thoughts about enforcement of masks for, some schools are going to be meeting in person and colleges will be meeting in person. What are going to be how is enforcement of using masks and social distancing going to be done in those types of settings?
Rose, I think the data is very clear that wearing a face covering and waiting 6 feet apart and washing hands, we keep seeing new studies come every day. There was just a new study out this week reinforcing that the 3 W's is not only evidence-based, but it works, and that we need to see everyone doing it. I think the governor the other day said it best in terms of expressing what he thinks about everyone needing to be wearing face coverings. We all are in this together. We all care about North Carolina. We all care about making sure that our communities are healthy, that our economy can thrive. And the tool that we need to use to do that is to wear face coverings, use social distance, and wash our hands. So we call on all leaders of our state, from the business community, the sports community, the education community, and the political community, to all come together to make sure that we are sharing these important public health safety measures together. These are important. Our expectation is everyone is wearing a face covering in public settings. Thanks.
Our next question is from Daniel Polgar with Progreso Hispano News.
Hello, good afternoon. My name is Maria Robles from Progressive Hispano News in Charlotte. My question is from Mr. Claudia Velasco. We would like to know what has been to help that the unemployed Mexican has been received in North Carolina from the Consul, and as being the process of repatriation of the bodies of the Mexican victims by COVID-19. Thank you so much.
Thank you so much. That you know, we have a lot of Mexicans working in several issues, several topics, and we are trying to reach that. That is so important that they have to be protected, and if they have any symptoms of COVID, they have to tell his boss that they need to do a COVID test. And we are working with the farmers, and of course we're glad that the North Carolina government is going to protect them. They are going to send some protection for them. We are very happy to this, but of course we have to still working with them to continue wearing the 3Ws. And yes, it's a big task, but we are trying to do our best in this issue.
Great, thank you.
Our next question is from Richard Craver with the Winston-Salem Journal.
Hello, Dr. Cohen. This is Richard Craver with the Winston-Salem Journal. I was wanting to see, this is sort of a follow-up on an earlier question, but we've had a story in our paper this morning involving a couple of strip clubs that have decided to, disobey or just not pay attention to the mass gatherings indoor executive order, and essentially it sounds like local officials are basically waiting for some sort of legal action before they take action. I was just wanting to get a sense for what the HHS might be able to do to reinforce the executive order on those mass gatherings like you did Ace Speedway.
Sure, thanks for that, Richard. So there are a number of folks who need to be doing better to pay attention to the details of our executive order. We would like to make sure that everyone is following those very carefully. We were very deliberate in how we have been thinking about easing restrictions. So the things that continue to be closed are closed for a reason, because they are high-risk settings where viral transmission is very likely. We have had good partnerships with our local public health departments. If we do hear about an incident like that, we do have our local public health departments reach out, make sure we're clarifying. The next step is then to partner with our local law enforcement. They are the enforcement arm here of this work, but to make sure that they are armed with the information that they need, and to help them in whatever way we can to make sure that they understand the reason why behind this. And so that is the next step. If we see ongoing and flagrant violation of this, we have used the abatement order. Again, we try to use that order sparingly when we feel like there is imminent hazard of the public's health, and we will continue to use that going forward.
Our next question is from Gonzalo Aguirre with La Conexión USA.
Hi, thank you very much for the opportunity. My name is Gonzalo Aguirre. I'm from La Conexión and La Conexión USA in Raleigh. First of all, I want to say thank you for the opportunity and for the effort to do these press conferences focused in the Hispanic community. And my question is for Dr. Cohen. We know that testing is one of the most important phases on the checking about the symptoms in the people for the pandemic, and we want to know if there's going to be more doses available. Right now, the free doses for everyone, and we are obviously concerned on the Hispanic community. There are limitations on the free testing for the people in general. So we want to know if there's going to be more doses available to check, more tests available on the freeway for our community. Because right now the waiting time to schedule an appointment to get a test is too long. So that would be my question.
Well, thank you so much for this. One, I want to take a step back. Testing is very important, but I do want to emphasize, I think the message you were hearing from both consul generals as well as that I was delivering today is we have to focus on the 3 W's. We have to work on slowing the spread of this virus and preventing it from spreading in our communities and doing the 3 W's. Testing's important, but I want to make sure we get the message out today that it's really about wearing a face covering, waiting 6 feet apart, washing hands, doing that all the time, every day, in all settings. That's really important, right? So just to focus on that. As far as testing, we absolutely know that testing and that turnaround times for results as well as capacity at some of our sites is not where we would want it to be. Turnaround times are slow across the board, as we have seen our commercial labs just be swamped with the number of tests that they are getting. Our hospital labs are having supply issues in order to process the tests. And this is not unique to North Carolina. This is happening across the country. So we have a number of ways in which we're trying to attack the problem. So first is that we need federal help, and we're trying to work with our federal partners both to understand how we can get the supplies that we need here to North Carolina, particularly to places like Charlotte and our main hospital, Atrium, that could be doing a lot more testing if they had those supplies. The second is to work on diversifying the number of labs that we have here. So partnering up some of the collection sites with labs that may be smaller but have capacity to turn them around. And then the third is thinking about using different types of testing. That may be other tests that still detect the virus but use different techniques to do that, so we don't have as much strain on our supplies. So that's all work that's underway, though it will take us a bit of time, particularly on the last one, to try to figure out how to do different types of tests. That is still science that is evolving as we go forward here. In terms of making sure that folks have access to the free testing, all this month we continue to put up additional mobile test sites in about 300 of them in about 100 different zip codes. We actually just added even more over the course of this week. You can find those free testing sites on our website at the Find My Testing Site tool that's on our website. They are labeled as free, so we encourage folks to take advantage of those, and we'll continue to try to ramp up testing availability as well as those turnaround times. Thanks.
Our next question is from Galo Baird with Norsan Media.
Good afternoon. My question is for Consul de Mexico and Guatemala. Many people lost jobs. Had problem for pay the rent for the medical consul. I had the help this family and the person in this pandemic for the people and the Guatemala and the Mexico, please.
Thank you for your question. Of course, we are aware that many lost jobs in the Mexican community has been, and we have some resources at the consulate for support this this difficult time. And of course, that the government of North Carolina already are working with 5 Latino communities, and they can help in this sense, and we can refer them to support. And that always the North Carolina government has been taking some action that to support if they can pay some other issues that they can affront just now. But always we are ready to help them. Thank you.
Thank you for the question. Yes, we are very concerned with a lot of Guatemalans and Latinos and Hispanics in the country have lost their jobs, and but it's through this crisis you realize how important the community support is, and all the organizations and community have not let us down. They've picked up and supported each other, which I think is very important. There's a lot of organizations that we have been working closely together to help these families. We even have a partnership, with the Hispanic Chamber of Commerce. People that have lost their job in one area can try to find another job in a different area, not where they were, but in a different industry that is having opportunities right now. So we're trying to help any way we can with resources or with other opportunities as well. Thank you.
Our next question is from Lexi Nelson with WCNC TV.
Hi, this is Lexi with WCNC Charlotte. My question is for Dr. Cohen. Mecklenburg County has restricted alcohol sales past 11 p.m., so our restaurants don't essentially turn into bars. But there's still a lot of concern that people will gather in other places. Do you think this alcohol restriction will actually make a difference?
Lexi, thanks for that question. I think as I look around the country to states that have their viral infections are really accelerating. The things that they closed first, they had to go backwards from their reopening. The things that they closed first were bars. Second were gyms. Third was indoor dining at restaurants. Right, what they're trying to get at are indoor places where we know by the evidence that there is more viral spread. So I very much support the actions folks took in the Mecklenburg area to make sure that we are living up not just to the letter of the law, but the spirit of what the executive order was, which is not to have folks congregating in a bar-like situation, even though they may have been a restaurant earlier in the evening. So as the governor mentioned the other day, we're supportive of municipalities and counties going further to protect their community than we have maybe with creating a baseline of restrictions for our state. I think it is too soon to tell how that will impact the numbers, but I think every bit helps. I think the message we're trying to convey today is that we know folks are weary of this virus. We know folks want to get back to school and to work and to the activities that they love, and we have tools to be able to do that. It's the 3 W's. It's wearing that face covering, it's waiting 6 feet apart, and washing hands. And the reason we repeat it so often is that unfortunately we don't have other tools yet to fight this virus. We don't have treatment. We don't have a vaccine. We need to use the 3 W's as our tool to reignite the economy and protect public health at the same time. Thanks.
The final question today will be from Bernice Malagon with Univision.
Hi, thank you so much. This is Bernice Malagon with Univision, and this question is for Dr. Cohen. The government already granted funds for 4 Hispanic organizations and 1 newspaper. Are you considering to provide more funds for punctual aid for undocumented immigrants who don't have access to health services?
You broke up a little bit towards the end, but I think you were asking about the 5 organizations that we are working, community organizations that we're working with. Bernice, do you want to say that part again?
Yeah, my question is if you are considering to provide more funds for organizations that can help undocumented immigrants who don't have access to health services.
Sorry about that. Much clearer. I think what we've been talking about through this last half hour has been the importance of focusing resources on our Latinx Hispanic community because we know they have been disproportionately impacted by this virus. So we're trying to do everything from making sure we're getting the word out and everyone knows about the 3 W's to making sure that we are surging testing availability. But we also know an important part of this crisis, making sure folks can stay home and isolate and get access to the care that they need. We have a wonderful network of community health centers and other providers who have been able to help our communities who may not have insurance or access to care. And so we continue to work with them. But I think it just speaks to the ongoing problems that we have here, the high uninsured rate that we have in North Carolina. One of the reasons is we did not expand Medicaid. These are folks who are working hard, most of the time 2 or 3 jobs. None of those jobs offer health insurance, and so they are without health insurance. I think one of the ways in which we can really improve our ability to respond to this crisis is to expand access to insurance coverage, and we can do that without investing any state dollars. We can just bring federal dollars here to help us fight COVID-19 and to help folks access the coverage that they need. Now, we're doing it without that tool. We're doing everything we can to leverage federal dollars and make sure that we can get everyone access to the care, the testing, the isolation supports that they need. But we need to make sure we're using every tool that is out there, and we are not using one of those tools right now, and that's Medicaid expansion. So that's going to be something you're going to continue to hear me talk about, the governor talk about, as we work to continue to fight COVID-19. All right, with that, I just want to thank my friends and the consular generals, both from Mexico and Guatemala, for their partnership in this, for continuing to share important messages, and to make sure that all those in the Latinx and Hispanic communities know how much that we care about them and want to make sure they heed these warnings today about COVID-19 and to take care and to stay well. All right, thank you all.